Hey, welcome back to Following Science, the podcast where we dive deep into the latest breakthroughs in science and medicine without all of the confusing jargon. I'm your host, Rutu Ruparel, and today we're talking about some incredible advances in breast cancer treatment. This is a topic that affects millions of people worldwide, so whether you're a patient, a loved one, or just somebody interested in cutting edge medical research like me, this episode is for you. So let's start with a quick refresher. Breast cancer is one of the most common cancers in the world, but thanks to research and innovation, treatment options are evolving faster than ever. Think of it like upgrading from an old flip phone to the latest smartphone. Our tools for fighting cancer are getting more advanced, more precise, and importantly, more effective. Now, one of the most exciting developments in breast cancer treatment today is targeted therapy. Now, instead of carpet bombing the body with chemotherapy, which is kind of like a one size fits all approach, and chemotherapy does kill both cancerous cells and healthy cells, targeted therapy is like a sniper. It only zeroes in on cancer cells and leaves the rest of the body as untouched as possible. Now, let's talk about Enhertu. It's a HRE2 targeted antibody drug conjugate. Okay, that's a mouthful, so let's break it down. Now, imagine you have a smart missile that locks onto a specific target. In this case, HER2 positive breast cancer cells. And HER2 is that missile. It finds cancer cells that have a high level of HER2 protein and delivers chemotherapy directly to them. The result? More cancer cells get destroyed while healthy cells are largely spared. It's like getting a delivery package where only the intended recipient can open it. Now, the significance here is huge. In the past, treatments for HER2 positive breast cancer were effective, but not always selective enough. And HER2 has also shown promising results, especially in cases where previous treatments stopped working. This means that patients who had limited options in the past now have a powerful weapon in their fight. Then there is inavolisib, a brand new P13K inhibitor for hormone receptor positive HER2 negative breast cancer that carries PIK3CA mutations. Now, think of P13K as a malfunctioning GPS in cancer cells that keeps telling them to grow and divide uncontrollably. Now, inavolisib corrects that faulty GPS, and it signals the cells to slow down or even stop growing altogether. This is a game changer for patients with specific mutation. Now, in the past, these types of breast cancer were more difficult to treat effectively. But now, with inavolisib, doctors can offer a therapy that can directly target the underlying genetic cause of that cancer's growth. Now, for hormone receptor positive HER2 negative breast cancer, a powerful duo has emerged. That is palbociclib and fulvestrant. Now, picture this. You're in rush hour traffic, and suddenly a traffic light stops every car in its tracks. That's what palbociclib does to cancer cell division. It throws up a stop sign, halting their growth. Now, fulvestrant, on the other hand, works by stripping cancer cells of estrogen receptors, making it harder for them to survive. Now, together, they make a powerhouse combination for stopping the disease in its tracks. Now, the beauty of this combination is that it allows doctors to control the cancer without resorting to harsher treatments right away. Many patients can now maintain a good quality of life while keeping the disease at bay. Now, let's move on to something else, a fascinating field, immunotherapy. Now, immunotherapy is all about harnessing your body's own immune system to fight cancer. Think of it like training an army to recognize and attack an invader that was previously in disguise. Now, one emerging immunotherapy drug being investigated is blinatumomab, also known as Besponsa. It was originally developed for leukemia, but now researchers are seeing its potential in breast cancer treatment. Now, imagine it as a double agent spy. It binds to both T cells, which are your immune system's soldiers, and cancer cells, bringing them together so that the immune system can destroy the cancer cells more effectively. Now, this approach is especially exciting because it doesn't rely on chemotherapy or radiation. Instead, it empowers your body to fight back naturally, reducing some of the harsh side effects that comes with traditional treatments. Now, it's a common stereotype among a lot of people that chemotherapy, that it's the cancer itself that causes these harmful side effects like hair loss, fatigue. But however, that's not the case. It's these treatments, such as chemotherapy, which have such harsh side effects. But now, with these new drugs and these new treatments approaching, what we realize is that we can empower our own body to fight these diseases because our body already has these inbuilt defenses to protect us. Like T cells, they're built in our body to protect us. And so what these drugs are doing is they're just empowering us to fight these cancer cells, which we weren't fighting before. And it also causes a lot of these bad, harmful side effects to like go away because now your body is fighting the cancer cells itself and you don't need harmful treatments like chemotherapy to help you. Now, moving on, let's talk about some checkpoint inhibitors. These are like taking the brakes off your immune system. Now, normally our immune system has checkpoints, which are safety measures to prevent it from attacking healthy cells. But cancer is sneaky. It tricks these checkpoints into staying off, allowing tumors to grow undetected. Now, checkpoint inhibitors flip the switch back on, letting immune systems recognize and attack the tumor. It's like lifting the invisibility cloak off cancer cells. This kind of treatment is still being studied in breast cancer, but it already has revolutionized how we often treat other cancers like melanoma and lung cancer. Now, researchers are also hopeful that checkpoint inhibitors will become a major player in breast cancer treatment as well. Now, additionally, what I would like to add on to that is these checkpoint inhibitors, or rather these checkpoints, they come in a lot of cancer cells. So while a lot of normal cells have like a certain type of protein that tells these inhibitors to or these checkpoints to stay off, a lot of cancer cells have been shown to also have such proteins in them, which is all why our body doesn't fight back at these cancer cells. And so by using these drugs and empowering our own body, we're basically helping these inhibitors turn back on, and we're basically fighting against these sneaky ways that cancer cells stay in our body and uncontrollably grow. Now, beyond targeted therapy and immunotherapy, there are some truly fascinating treatments that are being developed right now. So let's go into them, starting with stem cell transplants. Now, imagine your bone marrow as the factory where blood cells are made. When chemotherapy damages this factory, stem cell transplants work like a full renovation. It rebuilds the system so that new, healthy bodies, or rather blood cells, can be produced. Second, personalized medicine. Now, this is a game changer. Instead of a one-size-fits-all approach, which is what chemotherapy and other type of treatments that we currently have for cancer basically is, doctors are now tailoring treatments based on an individual's genetic makeup. It's like having a suit custom made instead of buying one off the rack. Far better fit and far better results. And lastly, 3D imaging. Now, traditional scans are looking at a picture of a mountain from one angle. 3D imaging, on the other hand, is like flying a drone around that mountain, and it allows you to get a complete detailed view of the tumor, or rather mountain in this case based on this metaphor, and it makes diagnosis and monitoring more precise because now you can tell what's going on with the tumor and now you have the full information instead of like the half information that we used to have. Finally, let's not forget about clinical trials. These are the testing grounds for the treatments of the future. If today's targeted therapies and immunotherapies are like state-of-the-art smartphones, clinical trials are where the next-gen models are being developed. Right now, trials are exploring new antibody drug conjugates, gene therapy, and vaccines. Now, starting with the first one, new antibody drug conjugates are just more precise missiles against cancer cells, like I explained before. Second, gene therapy is just altering a person's DNA to fight cancer at its root cause. And finally, vaccines are just training the immune system to recognize and attack cancer before it even starts. So, what does this all mean for the future of breast cancer? It means more hope, more options, and better outcomes for patients worldwide. The days of one-size-fits-all chemotherapy are fading, replaced by smarter, more personalized treatments that offer real results with fewer side effects. Now, considering if we look back to the past, we realize that how much cancer treatment has progressed, because before we used to do bloodletting and then we went to chemotherapy, but now the chemotherapy is slowly fading away. We realize that a lot of these patients, cancer patients, don't even need chemo, but they're being provided it because of this huge gap in medicine. And this gap is really important to talk about because this awareness does not exist even among normal doctors and practitioners. Because sure, people in areas such as MD Cancer Center are informed because they're the ones who are working on this cutting edge research related to biomarkers and these new treatments for breast cancer and other types of cancer. But what about the regular doctors and practitioners? A lot of them are just not up to date on these new treatments, and thus they're providing their cancer patients with chemotherapy and radiation when a simple drug or simple treatment that is not related to that could have been enough to help save their lives. Now, this is so important to talk about because, again, not only is health also being affected because these side effects are so tremendous that you should only be taking these treatments if necessary, but another factor, a lot of the people who are affected by these types of cancers are disproportionately affected, and a lot of them are minority populations who might not be able to afford these treatments. And so by continuously pushing them into expensive ones like chemotherapy and radiation, we're literally just widening that gap because there are cheaper treatments available that might even work better for their genetic makeup, for the genetic makeup of their cancer. And that's why it's so important to talk about all of this, because if we don't talk about it, then awareness won't spread. And if awareness won't spread, even the patients themselves won't know what to ask for, what type of treatment to consider, because they don't know what their options are. So what this episode is kind of doing is laying out all the options for you, because you never know, maybe not you, but somebody else might need this knowledge, which is why it's so important that we're all aware of the things that are going on in the medical world and the new advancements that are happening. Now, as I wrap up today, I just want to thank you all for joining me on today's episode. I love having you guys here, and I'm so glad you're listening. Now, of course, if you enjoyed this deep dive into breast cancer treatment, please be sure to subscribe and share it with anybody who might find this information helpful. And as always, stay curious, stay informed, and keep following science. Again, before I end, I love hearing from you guys, so please continue that. This is your host, Rutu Ruparel, signing off.